From the News Channel 5 Network, this is MorningLine.
Good morning, everyone. Thanks for joining us on MorningLine. I am Nick Beres. It is Monday, and I hope you had a safe and celebratory 4th of July. It was a rainy one at that, but it was pretty darn neat. I had a nice weekend. I hope you did as well, and thanks for joining us today. We're going to open up the phone lines for you in just a moment because we're going to be talking about your pets. If you don't have a pet, maybe your neighbor's pets or a friend's pet. We're going to talk about pet care, as you see this morning, sponsored by the Nashville Association of Veterinary Medicine, talking Ask a Veterinarian. Any questions you may have for our vet in the house this morning. Chad Givens, nice to have you on, sir.
Thank you so much.
You're just kind of feeling the seat, aren't you? Allison, Fields of Dreams is off today.
Fields of Dreams is off. Allow her to do a vacation somewhere and enjoy the holiday. So I'll fill in now and hopefully can be satisfactory.
I think you'll do just fine. He's been on before. It's good to have you on. It's nice to see you, my friend. And you know, the phone line's open 737-7587. If you have any questions or comments about your pets, give us a holler. But I wanted to hit it. As I said, it is the day, a couple days after the 4th of July, and you know it didn't matter. There were still fireworks going off yesterday. It's always a very busy time for the shelters. These animals take off, and then you also have these animals that maybe, especially if they were puppies, exposed to the first time the loud exploding shells and all of this, rattling their cage, PTSD after the fact. I don't know. What do you see with pets coming in after the 4th of July?
I think probably the biggest thing after the 4th of July is diarrhea, vomitings, GI upset from stress. I mean, these animals
stresses them out.
Yeah, whether it's people that have traveled and they've been boarded or they've been kennelled because the people were gone all day and then they came back home and neighbors shooting off fireworks or loud noises. I mean, some dogs have no issues at all.
That's right.
You know, and they could just kind of sleep through it, and then other dogs do. So, you know, you get a lot of that stress, all that energy kind of cooped up, and all of a sudden you get a diarrhea really easy or a vomiting, inappetence. And, you know, that's something that's really, really common. So today I'm sure like all the vet clinics around town are going to be dealing with GI upset and dogs that have, you know, had some accidents around the house. I know last week, just with the thunderstorms that were coming in and out every day, multiple times a day, and then the fireworks starting off, people just shooting them in the neighborhoods. You know, people are calling and being like, my dog's stressing out, I need something to calm it down. Yeah. You know, and I mean, there are several things you can do. Like you said, the Thundershirt or the Thunder Jacket.
Yeah, we use that on our Beagle.
Can help out with some. There are some natural calming agents. Rescue Remedies one, it's an herbal component. There's some newer components out that are kind of adding tryptophan in, you know, like Thanksgiving dinner, to calm things down. So you can do a lot of that, and then some dogs, you need some extra help, so we'll start doing some anxiety medications because some of them can get very destructive.
After the fact is what you're saying then, because I know you're right. The Thundershirt, which I highly recommend, it just wraps them around and keeps them feeling secure. Okay, but that's when I know it's coming. Now, these people coming to you now, and I worry, okay, you deal with the diarrhea or the vomiting now just because of the stress, and they get better when it's quiet for a while. But a balloon popping now, when maybe in the past wouldn't bother them, but because they've gone through the fireworks where it's all this loud, just a balloon pop now can frighten them. And so some of them, I think, are permanently changed, meaning that they're always going to be a little skittish around this loud sound now, whenever there is. So is there anything you can do to alleviate that? Is there any way to condition them so they get used to it?
Yeah, no, and I think that's a big thing is conditioning. Or what we tend to do is coddle when they're having a stressful event. We coddle them, and then we support negative behavior to make it worse. You know, so we're really bad about that as owners. So the big thing is when it does happen, you try to ignore it or you try to pacify the situation as best possible. Maybe it's the quietest room in the house, or you allow them to be close to you. You just don't, you know, support and pet them and do a whole bunch that kind of creates that bond during the time. You kind of ignore them. You know, they can sit there and shake or they can be beside you, and if they're there, that might be the most comfortable they feel. But you don't want to support a negative behavior. But like the Thundershirt, so if you know that it's going on, then you can do the Thundershirt and it might help out. Some of these little herbal things, sometimes even Benadryl does the job and helps out. So you kind of do that. You can condition by maybe playing thunderstorm music, you know, at a lower level and try to get them used to it, or have like fireworks on the TV and kind of condition them. Sometimes it doesn't work out well, but sometimes it does help.
It works, because I'll tell you, I mean, our beagle naturally skittish, and when the fireworks started, he freaks, okay? And before we got him, our pug kind of didn't really care.
Yeah.
But then all of a sudden the pug sees the beagle freaking out, and now the pug's freaking out.
Yeah.
And it's like, it's because he saw the beagle, not because of the sound. Now he gets freaked out. By the way, when the Benadryl I've used before, and I'm thinking for our pug, or what we would give the pug, it was just one. Is there a certain amount based on the size of the dog you give? I was just thinking it was one little tablet.
Yeah, you can do. I mean, your dose, say for like seasonal allergies, is usually like a milligram per pound.
Okay.
So you're using dose in like a children's dose or an adult dose, depending on the size of the animal, of course. So a milligram per pound is the generic dosing. Benadryl's very safe. Occasionally, maybe something can get allergic to it, but very rarely, and then more than likely a side effect can be hyperactivity. So not everything gets sedate with it. Sometimes it doesn't do anything at all, and then sometimes it does make some dogs hyper. Okay. So like your huskies, your hyper breed dogs anyway, it might not work quite the way you want to do it at that point, but you can do it. And like for allergies, I mean, maybe you go to 0.5 milligram per pound.
Right.
Sometimes for significant sedation, you can even go to 2 milligrams per pound, but the generic dose we'll use, or the recommended dose, is usually 1 milligram per pound. So 25-pound dog, 25 milligrams. So an adult, adult Benadryl, 25 milligram tablet is usually what we'll go with. So
that's one of those rare instances where you can give a dog a human medicine or something.
And
if
you give it and it causes sedation, too much sedation, you cut it back a little bit.
Dial it back.
So,
Makes sense.
But I mean, always if you have a question like that, call your vet. Because I don't know your individual dog's history, and you never know.
All right, listen, let's before we take our first break, some calls are coming in. Lines are open, 737-7587. Let's take one before we take our first break or two, and we'll go to Betty. Hi, Betty. Good morning.
Hey, Betty.
Good morning. I have a question. I have a tomcat that's about 7 years old, and he's lost his voice.
Can't meow anymore?
No, we look at him and we can see his mouth working, but I just wonder, maybe when he gets cooler, you think maybe his voice might come back. Now, he's healthy, he eats, and,
So he's intact male still?
He's inside in the winter months, but in the summer months outside.
And he's neutered, or?
Yeah, he's been fixed,
Yeah, so I mean, if he's going in and out, he definitely can get exposed to allergies. Seasonal allergies can affect the back of the throat and cause the vocalization, meow or purr, whatever they do, can be off a little bit. 7, don't have a lot of dental disease in cats at the age of 7, but you never know. Occasionally you can have a tooth infection, even a mass. We've definitely seen cats with tumors in their mouths. They can, sometimes some of the younger cats can get polyps, so they can get soft tissue inflammation. It can go from the back of the ear to the back of the throat, and that can create some issues. So it just depends. I mean, if he's going outside and potentially protect.
He's outside in the summertime. We take him, we've got 2, but we take him to the vet all the time, but he seems like he's healthy. At times his eyes has run, so I think maybe it might be allergy.
Yeah, definitely allergies, or he could have a little respiratory thing. If he's going out, like I said, he's going to probably be protecting his turf, so he's going to be probably talking to some other cats wandering by.
Yeah.
If he is,
okay then, thank you.
Yeah,
Sure.
so I just watched that.
Would you give Benadryl to a cat?
I know a whole bunch. It doesn't really seem like it does a great deal. But you can. It's safe.
Okay.
It's a lot harder to medicate
you
cats.
Find a way
but I mean, you could do it. I just don't find antihistamines really aren't consistent in cats.
I wonder, it's interesting that it's seasonal for her, maybe if it's allergies, but I know what she's talking about. I've been around cats before where they're meowing and nothing's coming out. There's and you're listening closer, and are they just soft-spoken? Are they timid, or is there something wrong with it? But if you've seen that,
I don't think
a
cat's ever soft-spoken.
No, so it's like they're meowing and nothing's coming out, and that sounds like what she's got, but I guess it happens.
It's hard to say. I mean, it could be nothing to something, but if he's eating and drinking and acting pretty normal, you've got some time to to watch it. But you know, definitely if he's losing weight or won't eat, something's really off, then you want to take him in.
Good. All right, let's take a break on that note. When we come back, we'll take more calls. Colleen's on the line. Stay there, Colleen. We'll get you first when we come back. Lines open, 737-7587 for the Good Vet. Here we'll be back talking your pets and more right after this. Stay with us.